After 70, 7 warning signs of vitamin B12 deficiency, the silent cause of memory loss, tingling limbs, and fatigue. Do you often feel exhausted even after getting a full night of sleep? Do you find yourself forgetting things more often and simply chalking it up to old age? Or perhaps you feel a tingling sensation in your hands and feet but assume it is just poor circulation? Surprisingly, all of these symptoms can sometimes be linked to a deficiency in vitamin B12. This is one of the most common nutritional deficiencies among seniors in the United States, yet it is frequently overlooked. After the age of 70, the body does not absorb vitamin B12 as efficiently as it once did. In addition, the long-term use of certain medications, stomach conditions, or a diet lacking in B12-rich foods can further increase the risk of deficiency. Vitamin B12 plays a critical role. If a deficiency persists, it can lead to more than just anemia. It can cause serious issues with memory, physical sensation, and mobility. The good news is that in many cases, a deficiency can be identified with a simple blood test. In today's video, we will explore 7 warning signs your body might be sending you if it is low on vitamin B12. Sign number 1. Persistent fatigue. This is the most common symptom of all. Many people describe feeling tired all the time, even when they are not doing any heavy lifting or strenuous activity. Waking up in the morning still feeling sluggish and worn out, needing to sit down and rest after only a short walk. Why does a lack of vitamin B12 cause such deep? This vitamin is essential for the production of red blood cells. Red blood cells are responsible for carrying oxygen throughout your entire body. When your body is low on B12, it struggles to produce enough healthy red blood cells. As a result, less oxygen reaches your muscles and vital organs. This leaves you feeling weak and drained. You may find it difficult to concentrate, and you might tire out much faster than usual. What makes this tricky is that people often mistake this fatigue for a normal part of aging or just a lack of sleep. Many try to fix it by drinking more coffee or energy drinks. But if the root cause is a vitamin B12 deficiency, those quick fixes will not solve the problem. If your exhaustion lasts for several weeks without a clear reason, especially if combined with other signs in this video, sign number 2, numbness or pins and needles sensation in the hands and feet. Have you ever felt a crawling sensation on your fingertips? Or a strange tingling in your feet while you are just sitting still? Some people describe it as a mild electric shock running through their limbs. This is a very significant warning sign. Vitamin B12 does more than just help your blood. It is vital for maintaining the myelin sheath, which is the protective coating around your nerves. This coating ensures that nerve signals travel quickly and accurately throughout your body. When you are deficient for a long period of time, your nerves can become damaged. At first, it might just feel like a bit of numbness. Later, that tingling or prickly sensation becomes more frequent. If left untreated, you could lose some of the sensation in your feet. This increases the risk of falling because you can no longer feel the ground as clearly as you used to. Of course, numbness can also be caused by diabetes, spinal issues, or other conditions. However, if the sensation is on both sides of your body and persists, it is worth checking your vitamin B12 levels. Sign number 3, memory decline and difficulty focusing. You walk into the kitchen but completely forget what you went in there for. You struggle to remember the name of a long time. You read a news article but cannot recall what it was about just a minute later. Many people immediately worry that they are developing Alzheimer's. In reality, a vitamin B12 deficiency can mimic symptoms of cognitive decline. Some individuals find it harder to focus on tasks. Their thinking feels slower than usual. They become increasingly forgetful, or they feel as though they are living in a constant state of brain fog. The important thing to know is that these symptoms can often improve if the cause is a vitamin B12 deficiency and it is treated promptly. Because of this, do not assume that every memory lapse is an inevitable consequence of getting. If you or a loved one notices a new decline in memory, consult a healthcare provider. Sign number 4, loss of balance or frequent stumbles. Does your stride feel less steady than it used to be? Maybe you find yourself tripping even on flat surfaces. Or perhaps you have to reach for a wall or a handrail to steady yourself when turning around. Many people dismiss this as just being a little unsteady in their old age. However, a long-term B12 deficiency can affect the nerves responsible for your sense of position and balance. Normally, your brain receives constant signals from your feet to know exactly where you are and how to adjust your posture. If these nerves are compromised, your brain receives incomplete information. This leads to a feeling of being off. You may feel wobbly or unsteady. This is especially true when walking in the dark or on uneven pavement. For those over 70, a single fall can lead to a hip fracture, head injury, or a loss of independence. That is why you should never ignore changes in your mobility. If you feel shaky on your feet or are falling more often, see a doctor. A vitamin B12 deficiency is just one possibility. Sign number 5, a red, sore tongue, or recurring mouth ulcers. This is a sign that many people are not aware of. Vitamin B12 is not just for your blood and nerves. It is also essential for maintaining the health of the mucosal cells in your mouth. When levels are low, some people notice their tongue becomes unusually red and inflamed. The surface of the tongue may look smooth or shiny. It might feel painful or have a burning sensation when eating hot or spicy foods. Some people also experience mouth ulcers that keep coming back. At first, they might think they are just stressed or dehydrated. They might try over-the-counter gels or generic multivitamins. However, if the real issue is a B12 deficiency, these symptoms will not go away without proper supplementation. Keep in mind that mouth issues can also be caused by low iron, low folate, or fungal infections. Do not try to guess the cause. Sign number 6, pale skin, shortness of breath, and a racing heart. As we mentioned earlier, vitamin B12 is vital for creating red blood cells. When the body lacks this vitamin, it cannot. This leads to a condition called megaloblastic anemia. When this happens, the amount of oxygen moving through you might feel winded after just a short walk. Climbing a flight of stairs might leave you gasping for air. Some people even feel their heart racing or palpitating as they move. This is the body's way of trying to pump more oxygen to your vital organs. It is worth noting that anemia caused by B12 deficiency often develops very slowly. Because it is so gradual, they often think they are just getting older and weaker. In truth, if the cause is vitamin B12, the right treatment can significantly improve your energy and color. If you are often pale, breathless, or feel your heart racing during light activity, talk to your doctor about the necessary tests. And remember, do not just take iron supplements. Sign number 7, mood changes, irritability, or feelings of depression. When people think of vitamin B12, they usually think of physical health. Few realize how important this vitamin is for the brain and emotional well-being. When the body is low on B12 for a long time, it can change the way you feel. Some people become much more irritable than they used to be. They lose their patience easily. They may feel more anxious or worried, or they might experience a lingering sense of sadness without a clear reason. Some people lose interest in hobbies they once loved. They might stop wanting to socialize or see friends. They may simply feel a lack of motivation to do anything. These symptoms are very easy to mistake for general stress or the normal emotional shifts of aging. However, in many cases, a B12 deficiency can contribute to or worsen these mood changes. It is important to remember that mood shifts alone do not mean you are definitely deficient, but if they appear alongside other signs like tingling, memory issues, or fatigue, it is a strong signal to get evaluated. Do not suffer in silence or assume this is just what getting old feels like. Why are people over 70 more prone to vitamin B12 deficiency? Many people assume that as long as they eat meat, fish, or eggs, they are safe from deficiency. Unfortunately, that is not always the case. When you are younger, your stomach produces enough acid to separate vitamin B12 from your food. The vitamin then bonds with a special protein called intrinsic factor, so it can be absorbed in the small intestine. But as we age, specifically after 70, this process can become less efficient. Some seniors develop a condition called atrophic gastritis, which thins the stomach lining. Others take acid-reducing medications for heartburn or reflux for many years. These factors can drastically reduce B12 absorption even if your diet is healthy. Additionally, those on a strict plant-based diet, those who have had stomach or intestinal surgery, and those with certain digestive disorders are at a higher risk. B12 is stored in the liver for several years, so a deficiency takes a long time to show up. By the time you feel the symptoms, the deficiency may have been developing for quite a while. This is why How can you prevent a vitamin B12 deficiency? The good news is that this condition is highly preventable and treatable if caught early. First, In the American diet, this includes lean beef, salmon, trout, and tuna. Seafood, eggs, and dairy products like milk and yogurt are all. Second, avoid taking high-dose vitamins without a reason. Many people buy supplements thinking they are always helpful, but not everyone needs them, and it is better to base your intake on a doctor's recommendation and blood work. Third, stay on top of your annual physicals. If you are over 70, especially if you have fatigue, tingling, or memory issues, ask your doctor if you should have your. Fourth, do not ignore digestive issues. Managing stomach or intestinal conditions can help ensure your body is actually absorbing the nutrients you consume. Finally, always keep your doctor informed about all the medications you take. Some long-term medications can interfere with B12 absorption and may require closer monitoring. Summary: vitamin B12 is only needed in tiny amounts. As we cross the age of 70, the risk of deficiency rises due to natural bodily changes and underlying health conditions. Today we discussed persistent fatigue, tingling or numbness in your hands and feet, memory loss and difficulty concentrating, loss of balance or stability, a sore red tongue or mouth ulcers, pale skin, shortness of breath, and a racing heart. The most important takeaway is to never diagnose yourself. These symptoms can be caused by many different health issues. Only a healthcare professional, through an exam and proper testing, can determine the true. If you notice several of these signs appearing together or lasting for weeks, take the initiative and schedule a checkup. Early detection and the right treatment can prevent long-term complications, especially. Thank you so much for watching this video until the end. If you found this information helpful, please share it with your family and friends, especially those in their 60s and 70s. Helping others recognize these signs early can make a world of. Don't forget to like this video, subscribe to our channel, and hit the notification bell to stay updated on our latest health tips for seniors. Disclaimer: the content in this video is for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Never disregard professional medical advice or delay